Reproductive Health Network Kenya, better known as RHNK, has a pool of 587 trained healthcare providers across the country. Our providers are mainly made up of gynecologists, providers, physicians, nurses, midwives, and the clinical officers. The gynecologists are mainly there to provide support to the mid-level providers. So basically, the highest number of our providers are mid-level providers who are found in the communities and hard-to-reach areas, and also the peri-urban areas of the cities. At the communities, the providers work very closely with the young people, and this is to ensure that they're providing the right information. The young people are providing the right information to women and girls, and also work very closely with the community opinion leaders, religious leaders, and engage in community dialogues, appreciating the role of the healthcare provider. And we all understand the communities tend to listen so much to healthcare providers. And when it comes to issues of abortion, then our providers are daily engaged in the community dialogues to demystify myths and misconceptions around access to safe abortion services. We also work very closely with policymakers, appreciating that Kenya has a devolved health system. At the national level, we work with the national government just to push for policies and guidelines that again provide an enabling environment for our providers to continuously provide services. We work very closely again with the counties to ensure that our providers are complying with the Ministry of Health requirements, and they are also providing quality services. Who is Nelly? So Nelly Introduces, who is also the Executive Director of Reproductive Health Network Kenya, is a trained nurse midwife and also a health systems management expert. I am passionate about women and girls, and also just a support system for healthcare providers, appreciating what the providers go through. I think during COVID, it came out very clearly the kind of issues or challenges that healthcare providers continue to face, not only in Kenya, but regionally and globally. So I am proud that I'm able to support healthcare providers and also understand as a healthcare provider what are some of the challenges that healthcare providers face. During COVID, we saw providers struggle to provide services with no personal protective equipment. And I was glad that I was able to reach out to donors, and they came in to support the RHNK healthcare providers who are in private practice. And our support was not only limited to our providers who are in private practice, we also have providers in the public sector who we provided for PPEs, and they were so extremely happy because they were able to continue providing these services, knowing very much well that they are protected. We appreciate partnership, and as the Director of Reproductive Health Network Kenya, I have ensured that RHNK collaborates, partners, works with other partners in this space, knowing very well that for service delivery, we cannot achieve that without, reaching out to other key stakeholders, partners that are very good in advocacy, and also partners that continuously support us in working with the national government to ensure that we have policies and guidelines, like I mentioned. I am so proud that I have been able to work with amazing young people, and this is just again appreciating that the number of girls and women that have been affected, for example, have been affected with unsafe abortion. The bigger number is the adolescent and youth in this country. And just getting to interact on a day-to-day basis with the young people that we work with, getting to understand what their needs are, and including them in our program and ensuring that we have them at the center of our programming has been satisfying to me, because at the end of the day, you see their response, you see that they are able to access these services, you empower them, and other institutions, organizations, civil society organizations are able to reach out to them because of their capacity, the knowledge that they have in the SRHR space. I mean, that builds my confidence, and I am happy, not only as a leader, but a woman who is also championing for the rights of girls in this country.